Hello friends. I know it has been a hot minute since I have done a video about COVID, but let's talk about COVID, because even though there are really pressing headlines happening about H5N1 and about the clusterfuck that is the current administration, COVID is still very much out there, still very high, plateauing in fact at a relatively high rate, and is still causing long-term damage. So let's talk about it. So currently 1 in 87 people, or about 1.2% of the US population, is actively infectious with COVID, which means that we have greater than 500,000 estimated daily cases, which is higher than the transmission was at this time in 2021 or 2022. Only higher than this time in 2023 and 2024, when we were experiencing a really large surge. But just because it's not as bad as last year does not make it not bad. You still have a 1 in 3 chance of exposure in a room of 35 people. So every classroom, especially in college, likely has at least one person that's infectious. But the bigger concern for me is that this was a prolonged period of higher exposure. That is an awfully long plateau. And I fear as flu cases begin to taper, COVID is going to start taking up that space. And likely part of the reason we had lower COVID cases relative to previous Januaries is because we have such high flu cases. Flu produces interferon in your body, something that COVID has evolved away from. So higher levels of interferon actually reduce your susceptibility to COVID. But unfortunately, that protective thing from the flu only lasts for about 6 weeks. But that is why you're much more likely to have acquired the flu in the hospital if you're admitted for COVID, but you're less likely to acquire COVID if you're admitted for the flu. The more you know. But COVID is worse than the flu. And the flu is also worse than colds. But really comparing the two is not a fair comparison, because COVID does some gnarly things to your immune system. Lots of them. That last for long periods of time after every single infection. And while most people get the flu on average every 5 to 10 years, most people are getting COVID 1 or more times a year, especially folks who have had no vaccines since 2021. So while the flu does trigger long-term consequences, there is such a thing as long flu, and it increases your risk for a heart attack for 6 weeks after your infection at any age, COVID causes damage to your immune system that lasts for 8 to 12 months after every single infection. And if you're getting it once a year, that means your immune system does not really have a chance to recover, which is why everyone is sick all of the time now. This isn't normal. It's not immunity debt. Because if it was, it would be fucking paid now, since it has been 4 years since we've had any kind of a lockdown, and people are just as sick, if not sicker, in places that didn't lock down at all, or came out of lockdown faster. But I digress. Here's a graph that shows the difference between your secondary bacterial infection risk following COVID or following the flu. They're barely in the same scale. Break that down in a more clear comparison. The orange is after the flu. The blue is after COVID. So no, not the same. And that's just the acute risk. We haven't touched on the long-term risk. COVID infections increase your risk of brain damage, even in mild and asymptomatic cases. Damage that doesn't seem to go away, but in fact is cumulative, meaning more infections means more brain damage. It's also causing heart attacks. Again, a risk that maintains for the 3 years that we've been looking for it. So if we still have the same risk at 3 years, the likelihood is it's not going anywhere. This is now your new normal. It also raises your risk of stroke. It's greatly increasing the amount of disability that we're seeing by a lot. And I know the government's going to try really hard to hide this data going forward, but pretending this isn't happening isn't going to change reality. And yes, this affects kids too. We also had another study coming out continuing to look at people who have long COVID and their recovery rates. And the data is just as alarming as the last studies that came out at the 2-year mark and the 1-year mark. At 3 years after initial infection, the majority of those with long COVID did not resolve, with less than 2% having resolved their long COVID. 2%. And despite that resolution, they still were worse off in their physical and mental health than those who did not have long COVID. Not good. And remember, that risk is cumulative. The more infections you have, the higher your risk becomes. So to recap, even though the media has said that COVID is mild now, and that COVID cases are low, there's still 3 times as much transmission today than there was at this point in 2021, 25% higher than this point in 2022, and as the flu recedes this spring, we are likely going to see an uptick in transmission again. More than 10 million Americans are likely to be infected in this next month. Meanwhile, this walking horror show is actively trying to get the COVID vaccine banned for all Americans. one that he developed in his first term. So if you haven't had a vaccine in the last 6 months, you might want to try to get one soon, just in case. And for all the trolls out there who are like, oh, those people with the clot shots, they're gonna be dying soon. You've been saying that for 4 years. Guess what? I've had multiple vaccines, 2 a year, every year since 2021, and I'm doing just fine. And in fact, I've only had COVID once, before the vaccine existed. Continuing to practice non-pharmaceutical interventions like masking and cleaning indoor air are some of the best things that you can do to protect yourself, because the risk isn't just the acute infection, which, I will reiterate, is still worse than the flu. But the risk is also the longer-term complications, the damage to your heart, your lungs, your vascular system, your brain, your risk of long COVID. If you value your health in the long run, you will reduce the number of infections you have. And mitigated, layered protection is your best way to do that. So just because COVID isn't the highest it's ever been, doesn't mean that it's low. It doesn't mean that it went away. It doesn't mean that it's normal. And protecting yourself still matters. Stay safe, everybody.